Hey, welcome to Blue Dream Health Collective, where we talk about real health as well as chronic illness, self-care, mental health, and other interesting and educational topics. I'm the host, Misti Blu, a biomedical science major and a chronic illness warrior. Thank you for tuning in, and I hope you love this episode. Hey, so how are you doing today?
I'm doing good, Misty. How are you?
I'm good. So you are an ER doctor. I want you to go ahead and introduce yourself. You can leave out as much as you want, just so that way whoever's listening to this can understand who you are.
Okay. So I am Dr. Christine Gosch, and I am board certified in emergency medicine, currently working with the Mercy healthcare system in Lebanon, Missouri, which is it's a smaller hospital, but I spent 17 years at a level 1 trauma center in Springfield, Missouri, doing emergency medicine as well. So I'm the medical director of the ER where I work currently, and then I'm a member of a staffing company that I've been with for the last 5 years, and we staff about 10 hospitals. There's about 4
Wow.
of us in the group, so that's a little bit about me.
Yeah. Well, you also have a med spa too.
Yes, I've owned a med spa for about 5 years.
That's cool. So, I wanted to bring you on as a guest just because I feel like there's still a lot of people out there that don't really understand coronavirus. I'm a huge Grey's Anatomy fan, and during the quarantine, I restarted it, so I kind of started from the beginning, and I finally caught up like right when this new season came out. And I'm not sure if you've seen it or not, but they are portraying coronavirus as it is, and it's really interesting because they're kind of showcasing like the burnout and how serious it is, and just the awkwardness in the beginning of the precautions and how different things are. So I thought it'd be cool if you could maybe discuss just what it's like having to adapt to this new world that we live in, and
Yeah,
and
I mean,
your side of things.
it's funny you mentioned Grey's Anatomy because I actually did just watch those. It's a couple minutes,
Yes,
but
they were good.
that's not the only series. Like Chicago Med is
Hmm.
also kind of focusing around COVID, and they've kind of
Yeah.
exaggerated it, I think, a little bit, and over technology, if I can say that word. They made it more technological than we really have it, but it is funny. But
Yeah.
yeah, I mean, it was a huge change, especially clear back in March when we first started this. We take off personal protective stuff for lots of things like other infections, but it's never been to the degree of COVID, other than back with Ebola. But then there wasn't the prevalence of it, so we just didn't go through all this mass training. But when it first started, we all had to go through training as far as how to don and doff off all of the various portions of the PPE and all the different steps to be safe, to not self contaminate, which it isn't just taking off the stuff you wear to protect yourself to go into a room. It's cleaning the workspace that you're working in, and not touching your face after you've touched other surfaces, and being close to other workers. I mean, it's just been so much to learn. And I actually ended up getting COVID and probably got it because I didn't wipe off the computer keyboard I was using after the person
Wow.
in front of me. So I mean, it's that little tiny. There's
That's
so many
scary.
details. Yeah, and it's just we had not had seen a lot of infection for the first couple months, and I think all of us became kind of complacent. And I'm just going to
Mhm.
sit down, log in, and get started. Then I'll clean it off, because we had been
Right.
super cautious, and just that little laxity, I ended up
Yeah.
catching it. So
Wow. So I know I was actually visiting in March because that was when after my father passed away. And I remember just seeing everything on the news, and we're like, we have to hurry up and get home. And this is crazy. And I remember you were even discussing then that this was before like the shortage of the PPE happened. And then everyone kind of got to the point where we started making our own masks and everything. It's just been really interesting to kind of see the different perspective, because I know it feels that even still now people don't necessarily take it seriously, which is kind of why I thought this would be a really great conversation to have. So is there anything, now that we're kind of seeming to have that second wave, like we're noticing the numbers are going up again, at least here in Florida. Um, is there anything that you'd want to say to people that maybe don't really think this is anything to take seriously?
Yeah, everybody really needs to take it serious, and it's not necessarily that we have lack of facilities, but like the hospital that I work in, we don't have the capacity to take care of some things because we don't provide those services. And
Mhm.
sometimes it's taking 5 hours or even 12 hours to find a bed somewhere, and we're talking 15, 20 phone calls and transferring people 300 and 400 miles away to get stuff taken care of. So it's increased our wait times, and it's a big deal. It's a big deal. There's a lot of time involved in putting on the PPE to go in and out of the rooms to see these patients, and it's a lot of exposure for the staff and other patients and the visitors not getting to come in. It just affects so many things. So people really need to take it serious. And it didn't seem real, I think, for so much of the country, because when it hit New York and it was so bad there, nothing else was happening anywhere else. So I think
Mhm.
to a lot of people, it didn't really feel like a reality. And now that it's really happening, people have kind of put it in the back of their mind and already made that assumption that it's no big deal. And it's hard to change people's minds once they've
Right.
kind of already assumed that mindset.
And I think a lot of people too, they got to the point where they're just over it. They want to go back to normalcy so bad that it's almost as if they're just denying that there still is this problem.
And I understand that. I mean, we are all over it and we all don't like it, but I'm
Yeah.
telling you, going through it and getting sick and having lots of complications, and seeing other people that I work with do the same. I mean, I think all of us are taking it way more serious now than we ever did in the beginning.
So what was your experience like being on the other side of this, being a patient this time?
Um, and I was really surprised at how bad I felt and how long it took me to get back towards what I thought was normalcy. To be, I mean, initially, like the first few days before I realized that my family was also infected. I mean, I was basically felt imprisoned in a room because you don't want to contaminate it for them. So it's very emotionally traumatic, and I to be
Wow.
isolated like that. But I mean, when you go through and you're so sick you can't even get out of bed to go get a drink, or you're too short of breath to drink fluids, and that lasted like 7 days. And then I thought I was getting better, and I tried to go back to work, and I started getting sicker. And so it's just it's not an illness that you really can predict the course of, and you think you're all going to be fine because so many people do fine. But when you don't, it's overwhelming. 'Cause and part of it is it's a new disease, and I think one of my bigger frustrations was it's such a new disease that no one knows what to expect or how to manage those complications. When people have complications, no one knows really what to do. So they're just throwing things at you, and some people won't even try. So it was
Yeah.
very frustrating being on the patient end of things. And you
And
don't
you
go
ended
in,
up
you don't go to the
relapsing or
hospital.
get
Oh, yeah, lots of complications, but it's like they tell you don't go to the hospital, and we're telling that to everybody. So you lay home, and how sick do I get before I really think I need to get a treatment? And I can't
and you
imagine.
ended up in the hospital, right?
I didn't get admitted, but I ended up being in the ER and needing supplemental oxygen, and it's just, yeah. I mean, it's just so hard. I can't
Mhm.
imagine being a patient and not having that medical knowledge in the background to try
Right.
to get through it if you really are getting sick.
So I've noticed that there have been healthy people who have been very, very ill, and then there have been people that maybe weren't quite the ideal picture perfect health that maybe just only lost their sense of taste. So, how does that work with having such different contrasting variations of symptoms?
Yeah, and I don't think we exactly know. I do think that there is some component of viral load, like how long you're exposed to something. But I also think there's a difference in some of the various strains of the virus, because I know who I got it from, and then of course Jesse got it, and we
Mhm.
all, the three of us that we all know had the same strain, we all got really sick. And you'll
Okay.
see whole families that no one, they get it, but no one really gets very sick. So I really think it's a component of those two things. And There probably is some genetic predisposition to some people who are more at risk to develop some sort of complication. I mean, I think I have some component of an autoimmune type thing. I have very like thyroid issues and joint issues and stuff like that. And I think especially autoimmune people, their courses they don't definitely don't do as well. And I think it's a genetic thing as well.
So, when you got coronavirus, you had, when you thought you were getting better, you ended up having to go back in. How long ago was that, and how do you feel today? Would you say you have some residual symptoms that have stuck around? Like, I know they're talking a lot about like post-COVID syndrome and having a long-term effect.
Yeah, I definitely have many things. I tested positive the 20th of August, and I'd had symptoms for about 4 days. So that's when I first got sick. I was off 14 days, went back to work for about a week and a half, and then I just started having lots of trouble. I shortness of breath was my big thing. So I just thought I had COVID pneumonia. Went in. That was when I ended up in the hospital. I did have COVID pneumonia, but I had this persistent tachycardia and I couldn't breathe. And I tried to go back to work again and ended up in congestive heart failure and had to be back off work again another 2 weeks. And so even now, I have that persistent tachycardia and I have to be on a beta blocker and a diuretic probably the rest of my life.
Wow.
Still more fatigued and don't have the exercise endurance that I had before. It's taken me a month just to be able to ride my bike, my Peloton for 30 minutes. I couldn't do it. I couldn't do it at all. I literally had to start at 10-minute rides. And it was only a month ago that I finally was able to start that. And I, now I've learned as I thought I was getting better. I have hearing loss. I've got probably permanent visual changes. So it's all mine is all neurologic, like POTS syndrome type stuff. But literally
Wow.
I can't go without my diuretic or my beta blocker, or I end up with my resting heart rate being 130, and with exertion it's 160, 170. So it's definitely
Scary.
altered my life. Yeah.
Wow. I've been hearing a lot. I've seen at the Dysautonomia International Conference, they had a whole segment on um, POTS, post-oral orthostatic tachycardia syndrome, and dysautonomia being a huge part of that post-COVID syndrome, which it sounds like you're experiencing. And that's when, do you have the blood pressure drops too?
I have the blood pressure drops.
And then,
I've actually, when they put me on the beta blocker, my blood pressure has actually gone up, which of course you wouldn't expect it to. So yeah, I do have all that. Until I got put on a beta blocker, I could not take a shower. I could not stand up in the shower for almost 8 weeks without feeling like I was going to pass out and having to get immediately back out. So I had to stay in the bath, take a bath,
wow.
because I couldn't stay standing up that long in the heat.
Hmm. Yeah, because for those who don't know, the heat can be a vasodilator, and that can also cause issues with like blood pooling and not getting that proper circulation. And when that happens, that's when your heart rate increases to compensate, and it's really uncomfortable. It can cause brain fog and headaches, migraines, nausea. There's a lot of other symptoms that kind of come with that. So it's almost like you get this huge dominoes effect.
Yeah, and I definitely had all of those symptoms,
Hmm.
and I've had to do other things to try to take care of those things as well. So and when you're starting to have all that happen, as you think you're getting better, you always just think it's your lungs. Initially I
Hmm.
was hypoxic, my sats were in the 80s, but steroids, after I went into the hospital and got put on steroids, my sats improved. My sats were 98%, and this was still happening. So I kept thinking my lungs should start healing, and I got another CT, and my CT was now clear. And why am I not getting better? And it was very hard, very frustrating. And my primary care doctor at the time was totally clueless. She would look at me and say, what do you think we should do?
Oh no.
I've done everything I know to do. So literally
Yeah, and you're the patient this time.
I had to change physicians midway through and get in contact with people that I know, like ICU docs that are working in the COVID unit. And I feel like I'm dying and I got to work. And I don't know what to do. So it was very scary. And there's really nothing set up for patients post-COVID who are having all these things. And I think that's pretty scary that they, other than that first 2 or 3 weeks when they're acutely ill, there is nothing to take care of the small percentage of people that end up with long-term complications. There's no way for them.
Right. And that's scary because, like you said earlier, this is still new. And so we're still trying to figure that out and what this means. Um, so it's definitely scary. So how would you describe, how do we describe this virus? Because, like you said, people think it's just strictly the lungs and like this terrible cold or flu, and then it goes away. But it seems to be much more involved than that.
Yeah, I mean, I think about it from what one thing is, it penetrates through your mucous membrane, so primarily your nose and your eyes, but it penetrates through the nose and gets into your systemic system by traveling through the olfactory nerve, which goes to your brain. So I mean, that's how permeable it is, and then it just goes
Wow.
everywhere from that point. So it literally can affect any and every organ in your body. I actually just got an email yesterday or the day before from one of our nephrologists where it's being found to cause some chronic renal damage as well, and that's new. I
Wow.
heard that. I mean, we're 10 months into this, and I hadn't heard that. So it's everything. It does affect everything.
And then, so going back to being a healthcare provider, uh, I've heard from other nurses and people in the industry that the burnout is real. What do you have to say about just being exhausted and working so hard in this new life that we live?
It's definitely real, and it isn't just burnout, because we're all working more shifts because we're covering for people that are sick, and of course we are always short, so that's one component of it. But the intensity of patient care is so much different. Some of that is all the extra time that it takes with the PPE, but some of these patients are really, really sick, and every time you go in, you got to put all that on, and they're needing to be intubated and have central lines put in and be put on multiple meds to maintain their blood pressures, and you can't ventilate them, and you're just doing all this stuff with them. But then you also got to come out and protect yourself and protect the next patient, and not have all that equipment on. So it takes so much time, and it's a little bit more emotionally involved. We went from having absolutely no visitors in the beginning, and then now we'll allow one visitor, but if the patient's COVID positive, we don't let their families come in because we don't want the virus going in and out. And so you're having to, to call the families. And so it's more time involved, and they're not there. So they're frustrated and they're angry, or it's added so much. And just the other day, it's like, I finally literally slipped the husband of a patient that was dying in our ambulance entrance, so he could made him don all the PPE equipment, and literally just let him go in and say goodbye. And it's just
Wow.
it's emotionally exhausting as well. It's hard to turn that off and go home, and you're exhausted, and you get home and you have to decontaminate. I mean, whether you dress and undress at the hospital or in my garage. I mean, it's
Yeah.
just because you don't want to bring it home either. I literally
Mhm.
sent my mother home so that I didn't end up getting her sick, because every day I came home, I was afraid. And that's the same thing
Right.
in and out of patient rooms, is you don't want to take it from one to the next. So
Scary.
it's
Do
been
you have any
challenging.
advice or I mean, are there solutions that are possible to help with just the emotional aspect of this for people who work in the industry?
I think some of it is, of course, rest and exercise and eating all those normal wellness things. But I think you really got to have someone that you can talk to, vent to, that really understands, that's maybe even someone that's in there with it. And then we do have a lot of kind of sarcastic humor at work, and we bring food in for each other and do lots of things to try to support each other. So there is some help in that aspect, but you've got to have someone to vent to, and then physically, of course, you've got to take care of yourself. And I mean,
Yeah.
obviously, all of us know that there's going to be an end sometime soon, so that also is part of it. just knowing that it will eventually get better, but life's never going to be the same. Patient care is
Absolutely.
never going to be the same, not ever.
Wow. Um, and what about advice to patients, since you kind of have that aspect of being both, the doctor and the patient? Do you have any advice to give to patients? Is if, if maybe they are worried about getting COVID because they have pre-existing conditions, or perhaps they already had COVID and they're concerned about the aftermath.
Um, I mean, a lot of it is just, be safe, be well, go into it as a precautionary approach rather than just waiting. And then of course, once you get sick, I mean, it does make you feel horrible. And people, if they can afford it, they really need to get a little pulse oximeter that monitors your heart rate and your oxygen level, because that's how we base a lot of our care on people. So knowing when they're sick and when they need to come in, and not coming in when they just have minor symptoms because they think they have it. There's ways to get tested without coming into the ER, and because that exposes everyone, that because we don't know necessarily. So they're walking through the main ER, and they're potentially, if people are in the waiting room. And so, knowing that you're sick and that you need to come in, and then obviously when you do feel sick and need help, getting in to get that help. So, because like I knew I was sick, and I didn't try to get help because I thought, so my salts are in the 80s, big deal. Well, if I'd have gone in before day 10, I probably could have gotten the antibody therapy and antivirals, and I might have done better, and I might have not have had all those complications. So it's very hard to know when you're sick enough and need to be there, or when you're not sick enough and you're just causing other issues by coming in. So that's just that one little thing, even though it seems so minor, monitoring your heart rate and your pulse ox is such a big deal. And I think the other thing is people, I've been sick 7 days. I got to get up. I got to go. Don't try to do it. I tried to. If you're exhausted and fatigued, you have to rest, because it just makes it worse, and you just keep getting sicker and sicker. And that's a frustrating thing. If you're not used to being sick, that's a frustrating feeling totally
Yeah,
unable to do anything. So
absolutely. I think that's a great point with the pulse oximeter, to monitor that and the heart rate, because I think that's a big fear that a lot of people have, is they do not want to go to the ER and they're avoiding that at all costs. And I think that was great to say that for sure.
yeah, and even some of the newer therapy, like the monoclonal antibody therapy that's just in the process of being released, that's based on risk factors, but those patients aren't the hypoxic patients. So just that knowledge, and it changes every day, so it's so hard for people to keep up with it. But there's the there are COVID hotlines that people can call, and I would say they need to utilize those and call those. But there's just so much, it's always changing right now.
And I did have a question too about, we're approaching or entering or already in flu season, where, I know a lot of people have gotten sick and had to get tested, and they were worried, and luckily only had, their yearly respiratory infection. But what do you have to say as far as entering now that we're dealing with not just coronavirus, but we also have flu season, and just it's that time of year?
It is going to be a little bit more difficult, of course, because there is some overlap in symptomatology. One thing that's happening, I work in several different hospitals, and in one hospital, they have a limited number of swabs. And so we aren't actually even testing for the flu. They won't even let us test for the flu because we need those swabs for COVID. We in this region have not seen a lot of flu yet, but in the other hospital, we're in Lebanon, where I'm the medical director, we just got the equipment for the rapid COVID, and the swab will run the rapid COVID plus flu A and B. So every time we want run a rapid, we're running flu A and B on those. So it's just every facility is different. I definitely think if we have a bad flu season, we're going to run out of swabs and not be able to test. And it is hard to differentiate between the two, but COVID, of course, has so many other systemic symptoms that flu doesn't have. So the more respiratory stuff, if they're not getting all the other stuff along with it, we may have to just assume it's the flu and kind of wait it out. And we, even now, before we had adequate swabs, a lot of us would, it was just a matter of put the symptoms together and assume you have it. And I'm sorry, you're going to have to go home and self-quarantine. And
Right.
that's probably going to be a lot of what happens as well.
And is there anything that you could say that you just wish other people knew? Just a generalized, statement that you wish people understood about coronavirus.
Well, I think, the biggest thing is that it is for most people a very minor or mild illness. Some people have no symptoms whatsoever. The percentage of those that do get really sick is small. And then of course the percentage that have long-term complications is even smaller. So overall, it isn't that bad, but a lot of it is the mask is not necessarily just to protect you because you may or may not be a low risk, but it is to protect others around you. And there is, there is data to prove that there is some protection with that. And you don't know that person across from you who might have some other complicating illness, and they might be that one that gets really, really sick, or they might be that one whose spouse dies from it. So it isn't just you that you're protecting, it's everyone else. And these are little minor things that we're asking for people to do, and we're all doing it. None of us like it, but it's not going to be that way forever. Immunity and vaccines will come, and it will finally lessen the load and what's involved right now. But for now, I just take it serious.
Absolutely. And then how do you think this whole experience being the patient being on the other side of the curtain has changed your perspective as a physician?
Made me take it more seriously, for sure.
Yeah.
And again, it's only because we went, we set up all the equipment and all the outside tents and structures to deal with this massive surge that we were going to get back in March. And then of course we saw what happened in New York and no one else saw it. And so we just, we kind of just assumed it was a no big deal. So it's been, that whole thing is just, it's been really interesting just to kind of follow through that.
Well, thank you so much. Is there anything else you want to add?
Not that I can think of. I feel privileged to be able to do this with you.
Thank you. I do. I'm like, I can't believe she said yes. I'm so excited. I just think it's definitely a really relevant topic. And I thought it was great that you have such a unique perspective, being that you were also really sick with it as well. And it's just, I feel like it's great to kind of give other people that education and knowledge of just kind of giving like a wider perspective of this.
Yeah. I mean, in the beginning of it, I never ever thought that, we were all being so cautious. I won't be the one, I won't get it. So, I mean, that was
right.
It was very, very unexpected, and it's a challenge, but it will get better.
Yeah. And I mean, it's been scary, like for me, cause I'm trying to find that balance of like, not to like obsess about it or live in fear, but also to be, the balance of also being cautious and protecting myself and my family and wearing masks, wiping things down, washing my hands and all of that stuff. So it definitely, being in that balance though, there's times where you kind of like fall towards one side or the other. But I'm just hoping we continue to stay safe and hoping for the best.
Yeah. If people just, you're exactly right. Hand sanitizer and mask. I mean, it's just little things.
Yeah. And I'm going to make sure, so, when I post this, it's going to be in a blog post, and in that I'll include the COVID hotline. And if there's anything else you want me to include, just shoot me a message and we'll share all the good stuff to everyone.
Okay. All right.
All right. Thank you so much.
Welcome. Good to see you.
You too. Please be sure that you subscribe to the blog, which is bluedreamhealth.com, where you can find additional links and information on this episode. You can also check out the digital magazine on our website, as well as find us on Patreon, where you can be a supporter.